this video, let us understand this serotonin syndrome. So basically, what is serotonin syndrome? So first, let's understand what serotonin is. Serotonin is a neurotransmitter of which is found in the brain, right? Serotonin, it kind of makes you happy, so you can remember more serotonin. So basically, if the serotonin increases so much, then you will land up with something called as a serotonin syndrome. And why is this serotonin increasing so much in the brain? Because you took an SSRI, that is a selective serotonin receptor reuptake inhibitor, selective serotonin reuptake inhibitor. You in combination with one of these drugs, that is a MAO inhibitor or tramadol or pethidine. So when you took this SSRI in combination with these, so let us make this a plus. So either this you took or this you took or this you took in combination with an SSRI, then the serotonin levels in the brain increase so much that it will lead to something called as a serotonin syndrome. So these all are serotonergic drugs. Okay, so this SSRI, MAOA inhibitor, these are antidepressants. Tramadol, pethidine are opioid analgesics. So if you are giving SSRI and the patient takes any of these, then you should be very careful, because it can lead to this life-threatening situation called as serotonin syndrome because of the excess of serotonin. Okay, did I say that right? Okay, even linezolid, okay, which is, if I'm not wrong, for antimicrobial activity, right? If you are giving, then it can also lead to serotonin syndrome because this impacts the MAOA inhibitor, okay? So, this is one of the SSRI, that is fluoxetine. So you can remember so many drugs are there, even escitalopram given very commonly with for antidepressant, right? For panic disorder, for obsessive compulsive disorder, for premenstrual dysphoric disorder. So many things they are giving this fluoxetine. So if the patient is taking fluoxetine, you have to be very careful, or if they're taking any SSRI for that matter, be careful. Don't give them MAOA inhibitors. Don't give them tramadol. Right, tramadol you might just give for pain, right? Be very careful. And pethidine also, if you are giving, be careful, because it will cause the serotonin syndrome, where what happens, there can be agitation, hyperthermia, delirium. It can even go to convulsions, right? It's life-threatening. So what and all is it causing? From agitation to convulsions, they have written restlessness, rigidity, hyperthermia, delirium, sweating, twitchings, followed by convulsions. Okay. So this is precipitated by when does this happen? When any serotonergic drug like a MAO inhibitor, tramadol, pethidine is taken by a patient receiving SSRI. Okay. So basically, how will you treat this? This is some external website which says that you discontinue the serotonergic drug. Basically, here what they are saying is misdiagnosis is very, very common in this. Okay, so misdiagnosis is very common. So anyways, if you diagnose it, then discontinue the serotonergic drug. You give supportive care, sedate, right? Because they have delirium, convulsions, etc. They can have, right? Then you manage the vitals. For hyperthermia, what will you do? Antipyretic, they are saying, oh, it is ineffective. You will not give antipyretic. In fact, they're talking about intubation, sedation, intubation. Okay. External cooling measures are supplemental. Okay. Then serotonin antagonist you can give. They are saying here, this is an external website, like I'm telling you. So you can give, what are these serotonin antagonists? There are some complicated names here. You can look at them. Okay.